everyone. This is another Freedom to Feel conversation, and my guest today is Amy Milroy. She is a double board certified psychiatric and family nurse practitioner, a certified psychedelic assisted therapy provider, and the co founder of Transcendelic. This is very inspiring, though. Even the word transcendence, transcending, I was just when I looked at your company's name, I just stayed there for a while. I paused. So I'll be asking you the question for the meaning that we might have an idea by now, but I'll ask you that question in a moment. So the full bio will be at the end of this interview. The question that I love asking my guests from the get-go for some reason never left me, and I always begin with this, besides the brief bio, is how would you describe yourself in this very moment, Amy? Who are you?
Hmm. Well, I am a trauma survivor who decided to co-found an organization to help people heal. Um, I wanted to found something that would be what I needed back years ago when I would have needed it the most. And so, yeah, I think trauma survivor is kind of the label or identity that's really resonating the most with me right now.
Yes, yes. And gosh, there's a lot that we can talk about trauma, right? And uh, one of the things that come to me, because I come from trauma too, a lot of that is this idea of small trauma and big trauma. Do you see it that way? Because from my view, I have a different perspective when it comes to that.
Yeah, it's so interesting that you ask that. I've been reflecting on this recently, this idea of the big T versus
Yeah,
the little t trauma.
yeah.
I find that I'm someone who doesn't gravitate towards black and white often and
Mhm.
things. Some things, yes, but
Yes,
some
yeah.
things, like big T and little t trauma, I think there's more complexity potentially there. I feel like sometimes we have the tendency to want to put a label and grade trauma and how
Mm,
severe it is.
yeah, yeah.
But trauma is always in the eye of the beholder. It's always in
Mm,
the eye of the
mm,
person who has experienced it. And so,
yes,
while it could
yeah,
be easy to say, well, this is a one
yes,
off, one incident trauma that could be moved through, that could be absolutely catastrophic,
right.
or to say that something ongoing, verbal, emotional abuse over the years, but you weren't physically wounded, so it's not that big of a deal. I think it's very
Right.
dangerous when we define for people
Mm,
how big or how little their trauma
mm,
is because
mm,
only they know how big or little it is to them.
yes, a billion times to that truth. So yeah, you basically that's it. You just clearly said everything that I wanted to say, that the way I interpret the idea of trauma, because we all have different, we all different, wired differently, and the sensitivity level is different. So we can't, I mean, just beautifully said. Thank you for confirming that. So our topic for today is psychedelic assisted therapy and healing in retreat settings. So my very first question to you about that is why ketamine?
Yeah.
Because there are different kinds of psychedelic assisted therapies.
Definitely. Well, I want to pause too and say for some people, they don't consider ketamine to be psychedelic. And so some people have different definitions, things that are more classic psychedelics like psilocybin or
Yeah,
LSD that are
yeah,
more serotonin promoting, versus ketamine is more glutamate promoting. So people might not agree, but in the sense that it expands consciousness, it causes new connections to form, it enhances
mm,
creativity. It allows people to move through blockages, um, creates neuroplasticity. All of those things are there. Accesses the spiritual realm,
yeah,
accesses parts of us that we may not have been in touch with, or memories we may not have been in touch with. So it's,
yeah.
to me and to many people, it is very much a psychedelic, and it happens to be a psychedelic with a really unique history. It has never been illegal in the United
Mm,
States. We have
right.
been using it since the 1960s. It is a Schedule 3 controlled substance, which allows folks like me who are licensed to prescribe it to
Right.
provide it in a legal fashion, which creates some more clarity around people who are seeking a psychedelic experience and they're feeling maybe hesitant around approaching
Right.
something that might be a little more gray area legally, or perhaps something that they might need to leave the country
Right.
in order to access. And so ketamine can be a really great thing in that way. And I think I could say a lot more, but I think the
Mm.
other thing I would really like to highlight is that ketamine is compatible with a lot of medications. And that
Yeah.
is something that other psychedelics are not. And
Right.
it's a really, really big safety concern to highlight, where
Right.
not only do we have the concern of serotonin syndrome, which can even be deadly if you combine, say, an
Mm.
antidepressant with ayahuasca, for example.
Mm.
Um, not
Yeah.
only do we have that, but just from the standpoint of where are we at right now in your journey? Let's meet
Right.
you where you are. Sometimes it's not necessarily the moment people feel ready to titrate down their medications. And so
Right.
it's really nice that they can meet up with ketamine and have a smoother handoff
Mm.
sometimes and still be continuing with their regular medications.
Yeah.
And then potentially, if it feels right, people do embark on a titration, as they feel their healing is progressing and they may no longer need the antidepressants, anti-anxiety medications, etc.
Mm. Wow. That's wonderful to know. And I heard amazing things about ketamine too.
Mhm.
Yes. Yeah. Um, I have a this open question for you about healing. What is how can we measure healing? Like what is to be healed if there is such a thing?
Yeah. Yeah. That's such a really interesting question, too. So, I think that healing is continuing to grow into the
Mm.
version of ourself that we want to be, the
Mm.
highest,
Yeah.
brightest, best
Mm.
version of ourselves.
Yeah.
I am
Mm.
a strong believer that there's no such thing as
Right.
100% healed. And sometimes when I say that, I feel like it might land in a maybe disappointing way for some folks.
Yeah.
But what I've found is that the really cool thing about healing, it being an ongoing evolution and a process, is
Yes.
that we get to see versions of ourselves that we didn't even know were possible. Because
Mm.
if we had stopped where we
Mm.
thought the goal was, wow, there were
Yes.
actually a lot more layers and
Mm.
levels to get to after that. And so it can actually become quite
Mm.
adventurous and playful
Right.
and creative, the healing process. And it's always, it becomes fun, I think, to just discover what's next as
Mm.
we continue to learn to love ourselves, know our worth, accept more and take more of what we need,
Mm. Mm.
reject more of what we don't need. Yeah.
Mm. Wow, I love that. I love all of it. It's just, yeah, it resonates true to me. Yes, absolutely everything. The playfulness of it and the unfolding. Yes, being open to what's next. And it is fun. I absolutely agree. When it comes to grief, death, like let's say we losing the body ourselves or losing
Mhm.
people that we love or losing things, even things that we attached to. How can we, how do we apply this concept of healing, especially when it comes to death? Would you say acceptance would be that level of growth?
Yeah.
I'm wondering.
Yeah. So I think that acceptance can be a really wonderful goal when it comes to any emotion, whether grief, anger. I like to say, like, no
Right.
emotion is bad. We need all the
Mm,
emotions.
yeah.
What we do with them can be
Yeah.
sometimes bad or can be harmful, but
Right.
the emotions themselves are not inherently bad. And
Right.
so, and nor is grief. And so I think, finding out what grief needs from us, and
Mm,
acceptance, I think, is often the end goal. And sometimes I think too, just giving ourselves permission to walk every step of the path,
yeah.
because even if we
Uh,
think, what I really want to get to with this loss, with this
mm,
death, is acceptance, sometimes
right.
I find that we may rob ourselves of the steps
Mm,
along the way.
right.
And it's okay and it's valid and it's
Uh,
beautiful to feel
uh,
every single step along the
mm,
way,
yeah.
even though we may know in the end, I'd like to accept this, but I'm just not there yet. And that's okay
Mm,
too.
gosh, that's beautiful too. I hear the voice of wisdom. Yes, it's okay to accept the unacceptable or not be ready to accept whatever it is. Yes, I think that's what has been the concept of wisdom. That's what comes to me, knowing, right, Amy, how to dance with life at every moment, really, and especially at some stages, especially when it has to do with suffering and pain. To me, that's a big one. That's when it really it shows a lot, like the work that we have done, and if we ready to embrace healing or spirituality, it's the how much we can show in moments of difficulties and challenges. To me, that has been my way of knowing for myself
Mm.
how calm can I be in chaotic moments. Is that something that you reflect upon too? How
Yes,
peaceful can I be if
absolutely.
I know I would die in 2 days? That's a big
Yes,
one.
definitely.
That would say a
Definitely.
lot, right? Is that how you feel too?
Oh yeah,
Uh,
for sure, for sure. And I wanted to really quickly, something you
yeah.
said just reminded me of a recent conversation. We talk so much in healing and trauma work about the inner child, the inner children,
Mm, yeah.
and also the inner elder, the one who just knows,
Mm,
the one who carries the
mm,
wisdom. When you
mm,
were talking about wisdom, I was
yeah.
reflecting on that, and the notion of the self, the soul,
Mm,
the
mm,
immutable, eternal, not a part of us, but the whole of
yeah.
us, that
Yes.
just knows. I very
Mm.
much believe in that too.
Yes, and that's gosh, that's what I'm passionate about it. But I don't know if it's it might be I can call it a passion, but I think it's a longing. It's a desire to know God, to know the divine, to know what is behind all this. When I was very little, I remember having this conversation with myself. I think I was about 6, 7. Oh, you're here again. I looked at myself in the mirror and I said, "Oh, you're here again in a girl's body." Like, where did that come from? That really intrigued me for for the rest of my life. It never left me. How did I know to say that? And that was really powerful, and it feels very real right now, even when I recall that moment. Like I had been here before. So that was the very beginning of my kind of journey into knowing to know, or maybe even not knowing, but realizing what we are. And now it comes to me a lot as it's almost like being it's almost like swimming in it already, like everything's already saturated. Everything's made out of the divine, so there's nothing really that's not divine, that's not sacred. And that's how I to me that's the most kind of powerful realization, to know that everything is that one, let's say, source, that some people call it, that one divinity that has split it into multiplicity. But it's, in a sense, it's not even divided. It is just it's almost like a dreamlike reality, and then it appears to be all this, but it's just really one thing. So I don't know. That has been the most powerful realization I have had. It was not through psychedelics, but I did experiment with psychedelics before, involuntarily. There was a
Mm,
retreat center in France, and they gave it
mm,
to me, this piece of cake, and then I was just all over the place. And I remember thinking about suing the place and all, and I got really angry afterwards. But then I realized how much I had learned. That was a
mm,
very powerful experience, and then I just
mhm,
dropped everything. So, and that got me deeper into the getting to realize the nature of reality, and that's where it's evolving, of course, in the sense of how to bring this into this reality of bodies, of how can we see, like, can we, using your beautiful word, how can we transcend the finite and be able to see the infinite in everything.
mhm.
So that has been my my fun dance. Looking at my husband every day, like, gosh, I already know you. But then at the same time, wait a minute, maybe I don't know you. And it becomes so much more interesting when I don't know who he is. And it's just, I mean, it's incredible. Um,
Mhm.
yeah, I would love to hear from you a little bit more about this idea of transcending. Is that something that we're really looking to do, or perhaps we're looking to unite,
Mhm.
return to union, to unity?
Yeah. Oh, I love that. Yeah, that's so true. It's so powerful, moving to have these unity experiences, whether
Yeah.
via psychedelics, via meditation, via
Mm,
prayer,
yeah.
people sometimes near death experiences as well. There
Right.
are so many ways to access this reality that
Yeah.
everything is intertwined.
Right. Right.
And so, in a sense, yeah, what are we transcending? Maybe we're
Mm,
transcending the notion that things are separate. Maybe we're
right.
transcending the notion that we're
Yes.
broken. Um,
Mm. Yeah.
we're transcending the notion that there's something to escape from.
Yes.
Maybe,
Ah.
and I think
Yeah.
the idea of transcendence, it's not always clear, maybe, what we're trying to transcend, but there's this
Mm,
notion of something higher for oneself. And I think then it could be that unity and that awe in knowing the interweaving of all things,
yes.
that could be the aspiration, maybe not in so many words and not necessarily in an
Mm,
intellectual conception, but maybe
yeah.
on a soul level
Mm,
for everybody in some way.
yes. 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 A billion times to that truth. Yes, that's how I feel with my entire being, that we are transcending what we are not. That's basically, I mean, it keeps coming back, this message. And then I find that there's truth in something that keeps coming back and in our minds. And also when we meet people that they keep saying the same things, I'm like, wait a minute, there's something here. But going back to what you do, so um, is that the idea of, gosh, engaging in ketamine assisted therapy? Is that something that one can do out of curiosity? I mean, I love the idea of curiosity. I'm very curious. So, would that be valid as well, or only in an intentional way?
Yeah, I think the use of psychedelics out of curiosity is very valid, very, very valid. And we have this really interesting combination, right? Where we're taking something that can open the portal to unity and transcendence, like
Yeah,
ketamine or like other psychedelics.
yeah.
And then we're kind of putting it into this Western
Mhm.
medical box,
Yes.
and prescribing it. And I do think, there is validity. I appreciate my ability to use my license to prescribe
Yeah.
it. But that interesting notion of, well, they need to have a
Mm.
diagnosis because we
Uh,
need to be able to prescribe it. And if you're prescribing, there needs to be maybe
right.
anxiety, depression, PTSD,
Right.
it can be used for a lot of different indications, substance use
Yeah.
disorder, etc. Um, but
Yeah.
that's where it can be a little tricky because
Right.
we're fitting it into that medical model.
Right.
I think, though, overall with psychedelics, it's a beautiful reason, to explore, to be curious, to see what else there is.
Right.
What am I meant to know from this? And always the notion to go towards is really the biggest guidance in a psychedelic journey too. Whatever's coming up, can I stay with it? Can I
Mm.
explore it with curiosity and compassion? So it's very much in lockstep with psychedelics, the curiosity.
Yes, yeah, I really feel that way. And I know some people are trying on their own, which is not, I don't recommend, and I don't think it's a good idea. I love I love the idea that we can use guides, that we can be guided, supported by a community or by somebody that has been through there for the same experience, or somebody like you, of course, that's certified to do this type of journey. But yeah, I do also talk to a lot of people here, and I know some people who do it on their own. And but I think they microdose. It's not
Mhm.
really dosing, because in this case, it's not microdosing in the settings that you work with, right? I mean, it's not microdosing. This is actually, you call it dosing, or is a full dose?
Yeah, dosing is a totally appropriate term for it. within my work, within the retreats and my other
Yeah.
clinical outpatient work, I'm working with psycholytic and psychedelic dosing. So the three sort of stages are the microdose, where it's barely noticeable,
Yeah.
psycholytic, where some of our sort of protective parts of us, more egoic parts, are
Mm,
a little bit softened, more relaxed. We
yeah.
can access some of the deeper material. And then the psychedelic, where we start to get into those unity experiences, what
Mm,
people call
mm.
trippy journeys,
Yes.
right?
Yes.
Abstract stuff,
Yes.
things that are ineffable that just words can't really describe.
Right.
So I work with the psycholytic and the psychedelic dosing. I'm not currently providing microdoses to folks.
Right.
And I think what you're saying, I really love that you're highlighting this, because it is a concern I have, as much as I have benefited myself, as much as
Yeah.
I've seen so many people benefit from working with psychedelic medicine, and particularly when supported in a great container. When it's done in a more unstructured way, without the proper set and setting, without someone to be a guide to help you stay safe, to
Right.
provide
Mm-hmm.
that
Yeah.
that guidance and that help with integration, it's difficult, whether that person is a shaman who has trained in an indigenous tradition over many years and
Right.
has a great breadth of wisdom in that, whether it's a coach, whether it's a licensed clinician, somebody. I think the most important thing in a facilitator is someone that you just feel comfortable with,
Mm.
solid
Yeah.
with. You can trust them, they're doing it
Yeah.
for the right reasons.
Yes.
um,
Yeah.
and so they're, having the right set and setting, the right mindset and the right setting and
Mm.
facilitator, it's it's almost the whole thing. The benefit that you can get
Right.
from the medicine is so much less without all of that, and it
Right.
can even be harmful, it can even be dangerous.
Mm. Yes, that is true. Yeah. Thank you for clarifying and giving more information, details about trying psychedelics without assistance. Yeah. For, I think they call recreation, right? I really, I don't like that idea at all. I never done it that way, and I would think about it even. One, because I also think that because I meditate a lot too, and for some reason that kind of helps me to go deeper into some layers of the
Mhm.
mind, and kind of access information that is that also can be done through meditation. So for me, has been has been the case. But you mentioned, I want to go back to this the clinical settings versus retreat settings. So what is the difference? I think I read somewhere on your website that there is a difference, and one is more is one more beneficial than the other, or do you recommend both?
I recommend both, and I think it depends on the person and what they're needing at this point in their life. What I love about the retreat setting is how very holistic it is, that we're
Yeah.
incorporating yoga, massage,
Mm,
meditation, meals. We have a lot of different team members that are collaborating to provide care for our participants. And it really is, it's very much borrowing heavily from indigenous traditions
mm,
that have
yeah.
been using psychedelics for millennia,
Yeah.
and working within their communities and their families to help each other heal. And so
Mm,
it's more like that, but also
yeah.
still with that, we're licensed and we're prescribing. So it's kind of that
Yeah.
interesting collision or
Right.
fusion,
Yeah.
and really just we owe so much gratitude to the tremendous lineage of indigenous
Yeah.
peoples for millennia. And I think it's a really exciting time that we can bring these medicines into new spaces within the Western context. And also, we have to make sure that we give attribution, and that we give back, because these powerful healing
Yeah.
practices did not just arise.
Mm,
They
yeah.
are very, very much informed by long human history prior to
Mm,
being able to prescribe in this way. So I think for some people, the retreat container and having a group setting is so very healing, to be witnessed by
yeah.
another and
Yeah.
accepted.
Yeah.
To have another say, oh my gosh,
Mm,
that resonated for me. Like
yeah.
what you just said, that really moved me,
Right.
to be able to just find that
Right.
alignment. I think it's a very lonely time for many people. And so
Mm, mm,
often friendships have arisen out of our retreats, and our retreat participants often stay in touch afterwards. And so the community that's built
yeah.
within is such a huge part of the medicine. It's
Right.
not it's
Right.
not just the ketamine, it's the whole
Right.
experience, and that we continue to follow with folks as long as they need us after, with integration circles online too. And so
Mm,
um, I think that the group work is very powerful in allowing people to feel that sense of, we are
yeah.
all in this together. No one is alone.
Yes. Yes. Gosh, there's so much healing power there. The combination of these elements, right? That you just mentioned, nature, and then you have psychedelics, and then you have the humans with the same intention, kind of coming together to help one another to heal.
Mhm.
So, I mean, the combination of that, of course, is transformative. It has been my experience too. And now with psychedelics, although I mentioned earlier, I did it, but it wasn't because it was not voluntary. I didn't ask for it. It was not a great experience, but
Mhm.
still was a valid one. That's interesting. I never thought I would say that, but I remember after having all these it is imagery. It's like images and messages. It's so powerful the way that it's almost is bringing the. I don't know if that's the subconscious or the unconscious. What is arising? Because I have the a feeling that we have been here before, so it's probably it feels like past lives too. It memories that I never had in this lifetime, but they felt so real, so vivid, and so true. So do you is that something that you address too when with your clients, past lives and those memories? Or, yeah.
Yeah, sometimes people discover things about their lineage. I've had folks I've worked with who have seen very vivid images from who they believe their ancestors were.
Right.
I've had people who relived their birth experience. That's actually rather
Mm,
common.
right.
Things that the cognitive mind, we can't piece it together, but suddenly we're there
Yeah.
within the psychedelic journey. And often these things go beyond what just logic or just cognition could provide.
Right. Right.
I think,
Right.
there's the idea of the collective unconscious via Jung that I think is a great lens for this work. And just that, maybe time is not so simple and linear as what we
Mm.
think too.
Mm. Ah, yeah.
I'm in a
Yeah.
place of awe and mystery, and perpetual curiosity with it,
Mm.
because
Yeah.
often we cannot logically explain, and maybe don't need to, what comes
Mm.
up within people's journeys. Often the lesson is, how did you feel? They'll say, well, I saw these weird shapes and I don't know what it means. How did
Yes.
you feel? I felt in awe.
Mm.
I felt a sense of joy. I don't remember the last time I felt
Right.
like that, right? And
Right.
so the lessons from a journey are often not
Mm.
things that go well into words or cognition. They can be more, yeah, discovering our lineage, meeting the divine, forgiving
Right.
ourselves. I mean, it's always an expect the unexpected situation when working with them.
Right. Yeah. That's also can be playful, right? I
Hmm.
mean, especially if we have guidance like somebody like you that's very kind and knowledgeable and have had the experience too. So that helps. I have a question, out of box question for you. Does this reality make sense to you? Like this, the experience of being human to be here. Does it make sense to you? I'm wondering without ketamine.
I would say not really. My
Mm.
my visceral reaction, my knee jerk there is like, not really. There are
Right.
elements that do, but I do think that there's a lot that we don't understand about this thing we're
Mm.
doing together called life.
Yes.
And
Yeah.
sometimes
Yes.
it feels silly. It feels like it doesn't make sense. Sometimes it feels really tragic. um,
Mm.
it doesn't, yeah, it doesn't really make a lot of sense to me a lot of the time.
Yes. Yes, that's also my intuitively. That's how I used to think when I was very little as a child. Wait a minute, this doesn't make any sense. But I didn't know why it didn't make sense. Now I have an idea. But even then, sometimes I ask the question about what's the purpose of life. I have asked, I think, to probably 1,000 people, and then sometimes I get the answer of it's just to be here. It's just this moment. And I really, I don't know. I think that's the answer that resonates the most with me. It's
Mhm.
just this, whatever this is, what we call moment in life, it just makes a lot of sense. And I don't know to what, to the intellect, to the soul. I don't know what part of me, but it's just being here now. Just whatever is happening, it is life doing what it does. It's not, there's no one really doing
Mhm.
anything. So I don't know if you have had this insight into, and a lot of people talk about spiritual teachers about being in the moment, how precious it is, this present moment, and how everything is here. But we don't often live that way. We don't experience life this way. And I'm wondering if we did, if that could change, make this huge impact, or just being all over the place, present, just going, being in the mind. It's also another way of experiencing this reality. I try to be very open to all kinds of ways that we can express this, because I feel like this is just the divine doing everything. So I really try not to judge anything and not to take any
Mhm.
answer or any concept as truth, especially when
Mhm.
it comes to experience,
Mhm.
but just kind of hmm, just know that I am observing something. There's something here, and that which is observing and witnessing everything, that's the true me. And that's the true
Mhm.
you, the true everything. So it is never really engaged with any action or experience. But because of it, we are able to have experiences. So
Mhm.
it's fascinating though. I can't help it.
Oh, it is fascinating. Yeah, that we're not the thoughts, we're the one
Mm,
observing the thoughts,
yeah,
right?
yeah.
Yeah. The present moment, it is, yeah, that's what life is. That's in a lot of ways, that's all we have.
Right,
Um,
right,
yeah,
right.
it's a really beautiful lens. Beautiful.
Right. Yeah, this is it feels like it's a practice. Some people talk about realizing this truth and living from that space, like just coming from that place, from that moment forward. But I don't know. It feels to me like the body and the mind, they need to be trained. They needed to, in a way, they have to understand and kind of find its alignment. It's almost like the finite aligning with the infinite and being okay with it. that
Mhm.
I am the infinite, although it feels finite, but I'm not, because I'm not the
Mhm.
body or the mind or the thoughts. So, but that's okay. That's a different conversation. Seems like it's a conversation that will be amazing to have under a guided ketamine assistance. That would be, I mean, session. That would be amazing. Right? All of us talking about these things. I mean, people have written books even about it. Conversations that they have had. I mean, they're just so much fun. But I want to go back to a question that I meant to ask you before. What are some of the obstacles to healing when it comes to kind of this uncovering of what we are in living a life that's more playful and in the moment, and being more open? What gets in the way of that
Mhm.
for
Yeah.
most people?
I think it could be larger factors, systemic factors, for example, poverty, lack of resources,
Yes. Yeah.
intergenerational handing down of things that are very difficult to get out of. It can be those
Yeah.
larger factors. It can be more personal factors like resistance within our system. It's frequently a thing
Mm,
that people will
yeah.
say, I
Yeah.
don't want to cry these tears because I feel like if I start, I'll never stop. And so
Right.
that story that we can tell ourselves about the pain, that it's endless,
Yeah.
is a thing that will reinforce the stuckness of it. And,
Mm,
sadness can
yeah.
become depression when it gets stuck. Fear can become anxiety when it gets stuck. And so,
Mm.
the ability to metabolize and move through memories, somatic sensations, emotions, and noticing whenever those narratives are coming up of it's not safe to feel this. This
Right.
means I'm going back to that place or that time. Noticing when those are coming up, giving love to that as it's
Mm.
valid, and
Mm.
also knowing that it's a story that has been created
Mm.
for reasons in our history and that we don't necessarily have to believe it, even
Ah.
though we can give love to it at the same time.
Yes, beautifully said. Yes, the stories. Do you is that something that you suggest or encourage? The let's say the creation of new stories, that like creating, rewriting our own narratives, the old ones, replacing them with new one. How do you feel about this idea of storytelling and yeah, the perpetuation of it?
Oh, it's so important. It's so important, when we look at people conceptualizing the story of themselves, of their family, of their lineage, of their community. Um, it's both and. We can come from so much pain, and we come from people who endured and moved through so
Yes.
much pain.
Yeah.
It's post traumatic stress, and it's post traumatic resilience,
Right.
and it's
Oh,
post traumatic growth, and so
yeah.
having the story of, wow, this is what we've been through, and we can
Mm,
honor that, and we should, and
right.
also look at where we've come and
Yeah.
look at how we've moved through all of this. Isn't that amazing? And
Mm,
creating a
mm,
new story
mm.
of
Yeah.
being someone who can handle it, coming from a lineage that
Huh.
was able to handle it, is a really powerful thing.
Yes. Gosh, yeah, you just kind of reminded me hmm, of that type of strength because I was not really, because of my story of in this lifetime has been very sad and traumatic. Kind of stayed away from storytelling, and I wanted it to kind of end the idea of creating new stories, narratives. But there's something about when you say that kind of activates something in me about where did it come from, that strength.
Mm.
And then I clearly see a lineage of people that it's incredible to just kind of yeah, pause for a moment and be able to honor that, because I do feel like that, I have all these lineages, these people. It's a mix of African and indigenous people, in, that I can clearly feel how how strong they were, how resilient, how powerful in so many ways. And I never wondered, where did this come from. I never asked that question for so many years, and for some reason now, this very moment, I'm being asked. It's almost like a calling to ask that question, to kind of to remember
Mhm.
them. And I don't really. That's interesting. I don't really know why, because I'm very good at it, listening to life and letting it just do what it does without trying to interpret or add anything. So yeah, as you said that, just again, it feels like a calling again. This is what I'm supposed to be dancing with at this time in my life. And I don't know exactly why. So, is this something, do you feel like there's timing? There's a time where we are ready for healing, ready to expand and grow. And there are times that we are actually, um, it's about learning and, in a sense, staying where we are so we can be with the pain to learn from it. I'm wondering if there's such a thing. What is your thoughts on that?
Yeah, well, I wanted to say also, I'm so honored that you shared about your lineage, and that's so
Oh
amazing.
yeah.
Um, yes, so amazing, the people that you come from, and I love that you're recognizing that. And the right time for healing, a concept that I use a lot in my work and that we use within our retreats for sure is the idea of the window of tolerance,
Mhm.
where
Yeah.
we want, ideally, as far as we understand in trauma literature and studies at the moment, ideally people's growth occurs most when they're pushing up against that.
Mm.
They're getting
Yeah.
into that area
Yeah.
that feels a bit unknown and it can be
Yeah.
uncomfortable,
Yeah.
but we're not flooding and exceeding either.
Right.
And so the window of tolerance changes
Mm.
throughout our life depending
Mm.
on everything, all the
Mm.
things. You know, how old
Yeah.
are we? What resources do we have? What relationships, etc. And so it's always
Right.
going to change. It could be different day to day. Today might be a day I really want to dive in and
Mm.
process something, you know, in
Yeah.
therapy or
Yeah.
in some other way, do a deep meditation. Tomorrow might be a day, whew, I didn't sleep very well. I don't have the bandwidth, and that's
Right.
okay too. But yeah,
Right.
I think it changes a lot over time, and people's window of tolerance will keep growing as they walk the healing path.
Right. Yeah. That also resonates true to me. Is that do you apply the concept of balance when it comes to this threshold and this window of tolerance? Is there something about life kind of finding its way back to balance like nature does? Because we are nature too, right? We are not apart from nature. We just for some reason believe we are something
Yeah,
else, but we are
it's
not.
true. True.
Yeah. So it's beautiful to see how like moments in my life when I was very unhappy, depressed, and see that something would spark a thought or something that it would bring me back into the trying to find solution for that problem. So, and I see that now because I pay a lot of attention. I'm always paying attention to my own self, and then I see how amazing it is this dance of balance that we are
Mhm.
always trying to go back to balance. And the question is what is balance? Balance is something that is static, it's a destination, or this is an ongoing movement that life is always getting, like nature getting out of balance to go back to balance. And it feels
Mhm.
like this is what makes this a human experience, isn't it, Amy? Or this what we call life, this movement. And it's never
Mhm.
static.
Mhm.
Does it
Yeah.
make sense to you somehow?
Yes, yeah, absolutely. I think balance does look different over time, probably for people. You know, there are seasons in our life that are meant for more rest,
Mm,
reflection, slowing.
yeah.
There are seasons in our life when we're ready to get up and go and make some changes,
Yeah.
and most seasons are probably a good solid mix
Mm.
of both.
Yes.
And so I think just really honoring what comes up for us, honoring our intuition,
Mm.
honoring what energy
Yeah.
and what resources we have, and
Yeah.
knowing that it's, as far as I know, and certainly in my experience on this earth as a human, things get out of balance and it happens. And, you know, just noticing it first. Oh,
Mm.
there we go. I was overworking again. Look at
Right.
that, you know,
Right.
and
Right.
giving compassion to that and noticing the
Mm.
reasons why things have started to drift.
Mm.
And trying to see, how can I invite more balance at this point? And that
Yeah.
comes also from a place of worthiness, of knowing we deserve to have that, you know. And it's probably not there's
Mm.
probably not a
Yeah.
perfect balance, but at least if we strive for what nature wants to do anyway,
Mm.
as you said, we're nature wants to go to
Yes.
equilibrium. Yeah, and so
Yes.
do we.
Yes. Yes. See, that's beautiful too. I love this. It's almost like a self talk. Oh, it's a combination of um, the longing to know oneself and curiosity. I mean, the longing, it's different. I noticed that because I always had this in my life, but I was not always curious about it. So at some point, I would just end whatever it is the journey was, the path, and then to just start a new one. But yes, I think it's just one of the things that I learned to do is just not to judge. That really helps when I
Mhm.
just let life do what it does, and I can just for a moment, at least for a moment, suspend judgment. Yeah, it's just not there. It changes everything. It's incredible how it might not change the outside, but change the way you see it. And in that alone, I mean, that's a huge change, isn't it? That's a miracle to me. If we can change the way we perceive ourselves in life itself, all the
Mhm.
people in the this natural world, then amazing things happen. And by that I mean it's really by feeling peaceful. It's almost like feeling again, going back to that unity again. It feels very peaceful at the level of the body mind. There's this peace that you can't explain really. It's love. I think that's what
Mhm.
I can say. That's love, freedom, maybe a combination of the three concepts. Love, freedom, and peace sets in when we just suspend judgment and we are just we are listening. We are listening to life itself do what it does without trying to make sense of it
Mhm.
through the intellect. Anyway, gosh, I could talk forever about that and keep you here for a long time with this conversation. That's what I love doing. And that's why I host this podcast. But I want to go back to, I want to mention your website, transcendelicretreats.com. It will be clickable on the podcast notes. But also, I know you have some events happening. Are they? I know I had this prepared here. These notes from 2 months. I think was 2 months ago. Is that still valid? July, September, and November. Talk to me about the retreats and what's happening from now, from today forwards, and also the services that you provide as a whole.
Mhm. Yeah, our next retreat is actually this week. It
Mm,
turns
oh,
out,
good.
yeah, we're hosting one from
Ah,
January 9th through 12th to kick off the new year. It's our New Year Restart
yeah.
retreat. And so we'll be hosting that in a couple of days. And then
Mm,
we're looking at actually in 2025 some new possibilities. We've done anywhere
ah,
from 3 to 6 day retreats so far.
yeah.
And different people gravitate towards different lengths. And of
Yeah.
course, we live in a very busy time, and often
Yeah.
people's schedules can't necessarily accommodate the longer ones. And so I've been feeling called, and my team has been feeling called to potentially offering some little bit more bite-sized ones. So that's something
Yeah.
we're looking for this year,
Yeah.
and dates to be determined and listed on the website once we have
Mm.
those.
Okay. Thank you so much for disclosing that information. And I know this interview will be published in 2 to 3 weeks, so we'll miss that for January. But yes, the website will be here on the podcast notes. Is there anything? We almost at the end. I do have this ending question for you. I mentioned the idea of freedom, but I'll ask you again. It has been amazing to talk to you, to be in your presence. It's very calming. It's almost like time again stops, and there's everything else is a background. It's amazing. Thank you so much, Amy, for
Oh,
being you.
I am so grateful. It's been
Thank you.
wonderful talking to you. I so appreciate your presence and your beautiful
Mm.
questions and your energy. And I feel so much like mindedness with you.
Ah,
And even the little girl thing you said about the mirror, I had such similar
yeah, you
experiences when
did.
I was a kid. And
Yeah,
I was
that's
thinking,
funny.
it wasn't just me.
Ah,
I've never said that, I don't think, to anyone. And
yes.
so thank you for bringing that up
Um,
too. And yeah,
yeah.
I appreciate you have such a beautiful soul, such a
Oh my
wonderful
God,
heart.
so you. Thank you. So for seeing yourself here, basically we're seeing one another. But what is I'll end with this question. What is freedom to you? How do you apply do you ap- how do you apply the concept of freedom in your daily practical life?
Hmm. I think freedom is living with authenticity
Mm,
and bravery, and living our story the way we were meant to.
mm,
And it
yeah.
can look different. Also, I think a theme of what I say is it looks different in different contexts.
Right.
For some reason, I know why the caged bird sings is coming to my head, and
Mm,
I
mm,
think freedom can
yeah.
be behind bars or outside of them. I think it is something that we can embrace moment to
Yeah.
moment of living in love, living in
Mm,
peace and gratitude, and continuing to look at ourselves and continuing to look at what reality is, whatever that is,
mm.
after all. I don't know.
Yes.
I don't have a really simple answer there. It's a little bit
Oh.
long, and I'm sure I'll think of something more later, but
Mm.
that's what came to mind for now.
Mm. That symbolizes freedom too, doesn't it? Just
Mhm.
like being in the moment and whatever, yeah, whatever it's here, it's meant to be here. Thank you so much again, Amy, for your presence in our reality and for your healing work and everything else in between. And we'll talk soon. We'll be in touch again. Bye for now.